My name is Dr. Scott Peseau at the Arlington Spine Center, and I'm going to go over instructing a patient how to use the wedges. The wedges that we use are hard, dense foam, and we use a series of 5 different parts to the wedge system. So I'm going to instruct a patient of ours named Teresa. And Teresa, come on over here. When you begin with the wedges, you're going to begin with 2 of them. The lower back wedge, your belt line is going to go over. So you're going to lay on these face up. Okay. And then the neck wedge has 2 indents, a large indent and a small indent. You're going to start on the large indent, face up. So you're going to lay on this face up on a floor, like a carpeted floor. Okay. The best place for these is in your TV room, because most Americans watch TV in the evenings. So let's see you go ahead and get on these, Therese. Now the neck wedge we want down as low as possible, so I always tell patients to lift up a little bit and then bring it even lower than that. Down here? Mm-hmm. Perfect. How does that feel?
Good.
Okay.
Legs up or legs down?
In the beginning, if your low back is really bothering you, keep your legs up. But then as you get used to these and you're able to tolerate more time on them, bring your legs down.
Okay.
So your first session that you do on this is going to be 5 minutes only. And then you're going to see how you react to that the next day. If you don't get overly sore, you're going to add some time on until you get to 15 to 20 minutes.
Okay.
Okay? And then when you come off of the wedges, you roll off rather than lift off. Okay? Now, Therese, once you can tolerate being on the wedges for 15 to 20 minutes, then what we want you to do is lift them higher so that you get more stretch. Okay? Usually that's going to occur in the neck first. The neck is much easier to change than the low back because we have so little muscle here compared to the low back. So when you can lay on the neck wedge for 15 to 20 minutes without a lot of pain, then you're going to turn it so that the smaller indent is up. Okay? When you can tolerate that without a lot of pain, then you're going to use a lifter, a 1-inch lifter. When you can use that without a lot of pain, then you're going to do your second lifter. Okay? Mm-hmm. In the low back, we have 1 2-inch lifter. It's very aggressive. So when you're ready for that, you're going to use that under your low back wedge. And that may take a month or 2 before you get to that point. Okay? And that's the wedge system. Now let me show you one other piece of foam to use. This is what we call the Tootsie Roll, and this is what you're going to use in your car or if you're seated for a long time at home. If you're going to be on a computer for an hour or 2, you just put this behind the small of your back like that. These are really, really good for a long trip in the car. Okay. Because as you know, if you sit for a long period of time, it really bothers your back.
So it's like rolling up a towel.
It's like rolling up a towel.
Just using the foam.
Yep.
Okay.
Yep. And that's how you use the wedges.